Good afternoon, and thank you for joining us for this very special webinar to launch the 10 Years Beyond Bushfires report. My name is Amanda Leck, and I'm the Executive Director at the Australian Institute for Disaster Resilience. And I'm delighted to welcome you to this very special Recovery Matters webinar event. I wish to start by acknowledging that I'm hosting this event from the lands of the Wurundjeri people of the Kulin Nation. I also acknowledge the traditional custodians of the various lands on which you all join us from today, and the Aboriginal and Torres Strait Islander people participating in this event. I pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters across Australia. ADA started the Recovery Matters webinar series last year to explore key issues in recovery and build knowledge and capability in the recovery workforce in the wake of the Black Summer fires. Of course, as we sit here today, there are many communities throughout New South Wales and Queensland who are now starting their own recovery journey from very major flooding, and our thoughts are with affected people at this time. The reality of the disasters we face and the future we anticipate with increasing complex, concurrent and cascading events demonstrates clearly that research such as the 10 Years Beyond Bushfire study with its long-term lens is deeply important. Our speakers will be introduced shortly, but first some brief housekeeping notes. Today's event will be recorded and made available after the event. Today, we will be using the Q&A feature on Zoom to take questions. So please post your questions in the Q&A box, not the chat window. You will be able to upvote questions by clicking the thumbs up button, and we will do our best to ask a number of these to our speakers following the presentations. I encourage you to use the chat window to share any thoughts or reflections during the presentations. And just a reminder that you will need to select all panelists and attendees in the drop-down menu for everyone attending today to view your messages. I would also like to remind you to please be respectful to each other and our presenters when posting your comments or questions. 10 Years Beyond Bushfires was supported by funding partners Australian Red Cross, Emergency Management Victoria, and the former Victorian Department of Health and Human Services. The research was also supported by Phoenix Australia and the Social Research Centre. The Australian Red Cross is also a partner of the Australian Institute for Disaster Resilience, and we are delighted to be partnering with them and the University of Melbourne to launch this important research. I would now like to hand over to Andrew Coghlan, Head of Emergency Services at Australian Red Cross, to host our webinar today. Thank you, Andrew.
Thanks, Amanda, and a very good afternoon to everyone. It's fantastic to be here on what I think is a really momentous occasion, is the 10-year report of this really important research, which from my perspective as someone who's been around this industry for a very long time is invaluable, because it starts to move our thinking around the long-term nature of recovery from the anecdotal to the more science and research based. So a fantastic opportunity that you're going to hear about this afternoon to really get our heads into that research and really utilise it in action over the coming years. And as Amanda mentioned at the outset, we have a very significant event unfolding in New South Wales and parts of Queensland with the floods at present, and the sort of thing that we're talking about today will no doubt provide really useful evidence for people involved in the longer term recovery of those communities as well as last summer's. So a few key points from my point of view. As Amanda mentioned, Red Cross is fortunate and proud to be involved both as a partner in ADA, the Institute for Disaster Resilience, but also with this particular piece of research. We've been involved with the University of Melbourne in what has grown to be a really very strong partnership over the last 10 or 12 years since Black Saturday, way back in 2009 now. We had some initial discussions with Lisa and the team, or some of Lisa's predecessors back then, around partnering up to do some long-term research, something that really hadn't been done that much prior to this piece of research being done. There's a lot of research around the immediate impacts or some of the psychological impacts in particular, but the broader long-term recovery trajectory of people is something that this research has really focused on. So from a Red Cross point of view, we were pleased to be able to provide some funding initially, but we've also been really pleased to contribute some of our experience and expertise. And I'd like to just acknowledge a couple of people in particular. John Richardson and Kate Brady, who both work with us in Red Cross, have made, I think, significant contributions based on their experience as well, which we've been really pleased to be able to do. The other thing that we've been pleased to do, which I think has been really critical to the research, is to link to affected communities. The value of this work has been in the engagement and collaboration with people who've been affected by events of Black Saturday to really draw on their experiences and come up with some conclusions that are going to be useful for the future. And I would suggest that people throughout have seen the value of sharing what at times have been very difficult stories and conversations. They've seen the value for future people going through future disasters in sharing their experiences. And we're very grateful to people for that. And presumably some of them are on the line today. So thank you very much from all of us involved. Last thing that I'd say before introducing the speakers is, as I mentioned, I think the value of this research really is moving the anecdotal to the scientific. And I would suggest that these findings that you're going to hear about over the next hour and a half have really reinforced what we've seen and heard about for many years, that the mental health and wellbeing impacts of disasters last for years, not months. And that's important to provide support to individuals, families and communities that have been affected by disasters over a long period of time. And I would again reference the work of Rob Gordon and others, Richard Bryant, who you'll hear from shortly, who've been immersed in this sort of work over a long period of time. It's great to actually pull a bit more evidence around some of their experiences. So from a practical point of view, that means that whenever a disaster strikes, we're now able to confidently plan for some of those longer term needs and start negotiating with funders, be they government, philanthropic, charitable, around getting long-term recovery programs in place. So instead of having the battles that we had 10, 15 years ago or more of getting money for a 6 or 12-month recovery program, we're now talking about multiple years. And I think that's a fantastic step forward that this research really helps us with. Enough from me, though. I'd like to introduce the stars of the show this afternoon, as it were, and we have three presenters and they will each speak for a period of time. And then we've left a reasonably good chunk of time for questions at the end of the session. So as Amanda said in the introduction, please capture those questions as we go, and myself, along with the other team from AIDA, we will do our best to grab the most salient and most popular questions and put those to our presenters. So first we're going to hear from Professor Lisa Gibbs. Lisa is the Director of Child and Community Wellbeing Program in the Melbourne School of Population and Global Health at the University of Melbourne. She's also the lead of Community Resilience in the university's Centre for Disaster Management and Public Safety. Within all of that, Lisa leads public health research in disaster recovery and resilience, and in particular, a strong focus on child health and wellbeing, with extensive experience leading mixed method and multidisciplinary studies with multiple partners and high impact outcomes. Lisa's published enormous numbers of academic peer-reviewed papers, as well as translating findings into very practical guides for partner agencies and wider audiences. And I think that's a really pivotal thing that we'll focus on this afternoon, is how do we apply this research in practice? What's that going to look like in the future? The second of our presenters will be Richard Bryant. Professor Richard Bryant is the Director and Scientia Professor of Psychology at the University of New South Wales in Sydney, and also the Director of University of New South Wales Traumatic Stress Clinic. He's researched the nature, course and treatment of post-traumatic stress disorder for over 30 years and worked on providing psychological responses to major disasters around the world, including the Ash Wednesday bushfires, the September 11 terrorist attacks in the States, Hurricane Katrina, also in the US, the tsunami of 2004, the Black Saturday fires, and indeed many others. Through many longitudinal studies, Richard has developed the world's leading screening tools for early identification of PTSD, as well as, again, developing those into commonly used early treatment protocols, which have been, in fact, translated into over 15 languages and used in many countries. So really some exceptional stuff there. And in 2016, Richard received the Companion of the Order of Australia, essentially for his services to research and management of traumatic stress. So good to have you on board this afternoon too, Richard. And thirdly, Dr. Colin Gallagher, research fellow, I should say, at the University of Melbourne. Colin is in his expert area is social network analysis in the Centre for Health Equity at Uni Melbourne, again in Lisa's School of Population and Global Health, as well as being a member of MELNET, which is the social networks laboratory of both Melbourne and Swinburne universities, a really important partnership piece that has contributed to some of this work. Colin's primary interests lie in the ways in which social networks within disaster-affected communities contribute to social capital, resilience and wellbeing. And they're really critical factors we know from the research in terms of indicators for both community and individual wellbeing. Colin's current work focuses on how person-to-person relationships influence post-traumatic mental health and wellbeing, and the role of local community groups in that recovery process. Enough of the introductions, let's get down to business, and I'd like to invite Lisa to provide us with an overview, please. So over to you, Lisa. Thank you.
Thanks, Andrew, and thanks so much everyone who's joined us today. It's great to be able to share this with you. It's certainly been a long time coming, and I know many of you who have joined us have been part of that process. I do want to acknowledge that I'm speaking today from the lands of the Wurundjeri people of the Kulin Nation and paying my respects to elders. And I also want to thank our Indigenous colleagues and scholars in that space who are helping us to build our understanding of Indigenous perspectives of disaster resilience. As has already been mentioned, and as you can see from this slide, there are so many people who have contributed to this process and so many organisations who are invested in what we are doing in our combined efforts to make a difference. But the point of the next slide is really to say, over and above all of that, thank you, as Andrew said, to the participants of the study, because oh my goodness, how generous to share the stories that they have shared with us at such a difficult time in their lives, for the most part, as they told us, so that they could make a difference for other people. So I'm proud to be able to say that we've really committed to that end, and that's part of the purpose of sharing this today. The next slide is really just a reminder that the 10 Years Beyond Bushfires builds on the original Beyond Bushfires study. And what we've tried to do with this report is to bring that in to the report so that people don't need to refer back to the 5-year report and the 10-year report. We've brought it together so that there's some sense of how things change over time. On the next slide, you can see who and how we involved people. And we were incredibly grateful for over 1,000 participants in our research in the formal aspects of the study, so the survey, which was repeated. And of course, this report comes out of the 10 years, the third wave of that survey, but also built on so many interviews and additional community visits, consultations, discussions that helped to shape what we were doing. And I can't believe that after 10 years, we still had 500 odd people who were still with us and still able to contribute. And that's the strength of this research and the findings. So I guess it's important to start with that the question we asked when we went back at 10 years, which was to say to people, well, do you feel that you've recovered from your experience? And remembering that in our sample, we included people from communities that were really highly impacted from the Black Saturday bushfires, moderately impacted, and also areas where there was low or no impact, so that we were in a position to understand what difference the bushfires made. So if you look at the next slide, you can see that when we asked people that question about whether they felt recovered, there were really very high numbers of people reporting that they felt mostly or fully recovered. but clearly there were lower amounts in those high impact communities. And just noting, there were 6% of people who said to us that question's not really relevant for us, so they're not included in these figures. But I think most notable is the fact that even when people felt that they were doing okay themselves, there was a sense that the community as a whole was not necessarily fully recovered. And that was particularly the case in the high impact communities. Thank you. Next slide, please. The other thing that we asked was whether people felt satisfied with their life as a whole. And what was really interesting when we look at how that changed over time was that there was a dip from 3 years to 5 years where people really were perhaps less satisfied with how things were going, but this picked up again at 10 years. So we do see an improvement over time, although not quite as high in those high impact communities. When we asked about experiences of post-traumatic growth, we did see higher levels in post-traumatic communities, in high impact communities. So there are different patterns depending on whether we're focusing on life satisfaction or experiences of growth or positives that's come out of quite dramatic experiences. Back to you, Andrew.
Thank you. And thanks, Lisa, for some really interesting insights there to really set the scene for the discussions this afternoon. I think that last one about life satisfaction and growth is a really interesting one. Something that I think this particular piece of research has probably explored more than many others is looking at the potential positives that people are able to make of these experiences. So that's something that I think is, while perhaps not unique, it's certainly something that has been explored in quite a bit of depth in this research, which has been really enlightening for us. So handing over to Richard now to talk us through some key issues, particularly around mental health impacts and major life stressors. Thanks, Richard.
Thanks, Andrew. And hi, everybody. I'm actually talking to you from Sydney. So I'm on the Gadigal people's land. And it does, as Lisa said, it's quite remarkable that it's more than 10 years since Black Saturday. And I'm really pleased to be talking about this because, as Andrew said, I've been involved in many, many disaster type studies over a long time. But this particular study is pretty unique in a number of ways. When we set it up more than 10 years ago, we had a couple of things in mind, and we assessed the mental health effects like most studies did, but there was a strong community focus in this. And there was also a strong focus on not just the individual, but the social environment, which is what Colin will talk about after me. And these are really quite unique. And the fact that here we are talking about things 10 years later is also really, really unusual. But I want to focus primarily here on the mental health effects and to give you a snapshot of what's been happening in the communities over the decade after the fires. Next slide, thanks. Now, in terms of what we know about mental health and disasters, there are gazillions of studies out there that tells us that disasters make people unhappy. And you don't need to be an expert to know that. These studies tell us that it does lead to increased PTSD and depression and substance abuse. But it also, all of these studies do tell us that the vast majority of people are resilient. That is, despite the challenges that they went through, that most people have been able to cope. Next PowerPoint, thanks. But one of the challenges for the Beyond Bushfires was that if you actually look at the disaster research, we actually know very, very little about the long-term effects. And this is really a big, big issue when it comes to natural disasters. Because very often what happens in a disaster is that governments and other agencies often look at what happens in the first year or two. That's when all the resources are put in. And then soon after, people then move on to the next disaster, or they're focused on other things. But what happens to the people who were most affected 5 years later, 10 years later? And this is a real issue because often they're forgotten. And it's really important to be understanding how are people traveling a decade after an event like this. Next slide. So this is what we've done. We've looked at a whole bunch of mental health outcomes, and I just want to give you a snapshot of where things are at. And what you're going to see here is a very similar pattern on all the indicators of mental health, where the people in the low impacted communities basically are reporting mental health problems that are pretty consistent with what we know is the community norm around Australia. In Australia, we have done a lot of community surveys, national ones, and the low affected communities are pretty consistent with those. And we tend to see them in the medium affected communities in the fires, slightly elevated over and above community norms, but predominantly it's in the high affected ones. That's where we do see the major problems. And here we've got the rates of PTSD that was related to the fires themselves. So people were having post-traumatic stress reactions, and the survey actually asked people about their reactions to the fires. And we can see here that the rates were in the first wave, three years after the fires, was about 15%, but it has come down over time. But the rates of PTSD now in the high affected townships and communities is still about 8%. And that is more than twice as high as what we would expect to see in the community. Next slide. We also asked about PTSD generally. And this is really interesting because, again, if we looked across at all of them, we can see much higher rates. And if we look at the high affected areas, at 10 years after, which is the green bar, all the green bars are the 10-year ones, 17% of people met criterion for PTSD 10 years afterwards. Now, the difference between the fire-related PTSD and the general PTSD, I think it reflects that a lot of people in these communities, due to other disasters, as Andrew said, these weren't the only disasters. There are fires, there are floods, there are other things affecting people. There's economic downturn. There's a lot of stresses on people. It does contribute to a lot of ongoing stress reaction. And we can see that even in people in the low affected communities, they're also elevated relative to community norms, probably because of just ongoing hardship that we often see outside major metropolitan communities. Next slide. Depression is very common after disasters, and it's no different here. And we can see that even though the rate has come down in the high affected regions 10 years later, we're still looking at a rate of 10%. And this is more than double of what we would see in the rest of Australia. Now, that's, again, a very significantly high rate of depression. And even though it's reduced, it's still worryingly high. Next slide. We also gave people a measure of generic distress, and this came, we could categorize it into different levels. And when we looked at people with very high distress, again, we can see that in the high affected communities, these rates are still very, very high. 6% is, again, at least twice as high of what we would see in the community, the way this particular measure is scored. And it's interesting, this particular measure is actually what's put into the national survey. So we actually have data on this from people across Australia. And this is really telling us that people in the high affected areas are still relatively much more distressed than people in the low affected. So it's not just that they're having more ongoing stresses, but there is something about being in these communities that were so badly affected in 2009. It's still having an impact now. Next slide, thanks. Now, when we put all of these disorders together, because a lot of these people just didn't have one problem, they often had either one, or they had two, or they had three. But if we just bundle them together and say, if a person actually has any disorder, how are these different communities traveling? And it's interesting that if we think about it in that light, whereas 25% of the population in the high affected communities had some disorder 3 years after the fires, 23% still have some disorder 10 years later. Now, that's 1 in 4 people. That's a very, very high rate. Now, it's a lot less when we look at the medium and the low, a lot less. And again, it's telling us a general story that if you're in one of the high affected regions, then you have been through a lot. And 10 years later, there's a significant proportion of people who are still having a problem. Next slide, thanks. We also looked at heavy drinking. And this was really an eye-opener for me, because we nearly always see in disaster research that people who are most affected to traumatic events and typically to stress reactions as a result of that, it often leads to self-medication and greater drinking. We actually did not see that so much here, but rather we just saw very, very heavy drinking across the board. It really wasn't affected by the community I'm in. Or my exposure to the fires. And it wasn't really affected by how many years it is. What it's telling us is that generally in these communities, over time, there is a standardly high rate of drinking across men and women. And these rates are high by Australian standards. Next slide. Now, interestingly, we also looked at subsyndromal disorder. By what I mean by that phrase is that the people didn't meet sort of the criterion for having PTSD or depression, but they had still had anxiety or depression or PTSD, but it was actually of a lower level, but it was still there. And it's interesting to consider these rates, because we need to understand that just because I don't have a disorder doesn't mean the rest of the people are all fine. Everything's totally good. There's a lot of people in the middle who are having some distress, but it just might not be extreme. And you can see in 10 years later in the high affected regions, again, that's 1 in 5 people. And that's important because we know from a lot of other work that people with these levels of distress still have a fair bit of impairment, and this can actually impact a lot on people's capacities to function. Next slide, thanks. And look, I know I've talked a lot about the people with problems, and I think it's really important we do, but let's not keep, let's not forget that the vast majority of people were resilient throughout. 3/4 were resilient 3 years later. 80% of people in the high affected areas are resilient 10 years later. Now, we know this from all studies. Most people are resilient, and there's many reasons why this is the case. Often it's to do with things that are actually happening, but let's keep that in mind. And next slide, thanks. This is a little complicated, but I did want to point this out because I wanted to highlight that across the waves, with something like general PTSD, even though the rates of PTSD can be sort of seen as a certain number, I don't want you to think that they're the same people. Because when we looked at the people who actually had PTSD at wave 1, and then who are those people at wave 2 had PTSD, and then of those who had PTSD in wave 3, what we see is that a lot of these people actually are moving their psychological status over time. So half of the people who had PTSD at wave 2 actually didn't have PTSD at wave 1. And half of the people who had PTSD at wave 3 did not actually have it at wave 2. So people's psychological state is waxing and waning as the years go on. Sometimes it gets better and sometimes it gets worse. Next slide, thanks. Now, why is that the case? Why are some people actually worsening over time? Now, I'm not going to go through all the different disorders or you'll all hang up on me. It'll get too boring, but just let's take the example of PTSD. In terms of what we know about the predictors of people's worsening PTSD from 3 years after the fires to 10 years after the fires, why does it get worse? Well, it's people who are female, people who were feared for their life more in the fires, and it was people who had subsequent traumatic events. And in what we know about the disaster literature generally, this is very commonly known. We know that being a woman, you are twice as likely to get PTSD than if you're a man for a bunch of different factors. We know that the fear for life is a major driver of it. But also, we also must keep in mind that it's not just the trauma itself, but it's all the trauma and stress I go through in the years later. This also has a massive impact on the likelihood of me developing PTSD. Next slide, thanks. And in terms of worsening depression, these won't surprise you, but it's the worst property loss I had in Black Saturday. And that's not a surprise. And the recent life stresses. And again, we know this from a lot of disaster research, that what we know is that if people lose property, then they're losing income, they're losing infrastructure, they're probably going through a lot of stress in terms of rebuilding, insurance, et cetera, and the more stress that goes on in terms of my recent years, that's just compounding my psychological state, and it's going to make me worse. Next slide, thanks. So the take-home messages, I think, from all of this are, most people are resilient, and you know that's the good news. But there are a significant minority that are still affected psychologically. And I just want to, just as an aside, say, don't fall into the trap of thinking there's anything wrong with those people. Increasingly, we're learning that often the biggest drivers of why people are still affected psychologically is that they're dealing with a lot more. There's a lot more on them, a lot more stress, be it financial, be it employment, subsequent stresses, subsequent traumas. This is a big issue. But the other thing that's that I think I really want to sort of highlight is that many of these people who needed mental health assistance were not receiving it. Up to a half of the people who are most distressed at 10 years, up to a half, hadn't actually received mental health assistance in a previous critical period of time. And I think this is a really important point, because we know that there are many mental health services available. Lots of services have been put in play, but there's always barriers to care, and people needing help, connecting with people who are offering help, always needs more work. And I think it's one of the great challenges moving forward. And I will stop there and hand things back to Andrew. Thanks.
Thanks, Richard. Some fascinating insights you've shared with us there, particularly from my perspective, at least. I've always known there's been a lot of research and information around PTSD, but I think what we're seeing in this piece of research in particular is moving into that discussion around general distress and general disorder, which takes the research to another level and gives us some really good insights into the broader community impacts, as well as obviously the very pointy end of people with PTSD and various other conditions. Can I just quickly put in a reminder about the questions opportunity? At the end of the presenters, we will have some time for questions. Please take the opportunity to type something in or tick support of one of the questions, and that will help us prioritise when we get to that point. We'd now like to transition a little from the individual focus that we were hearing through much of Richard's discussion there to more of a group dynamic and some of the circumstances there. So I'd like to pass over to Colin, who's going to talk about social factors, particularly networks, couples and groups, and some of the impacts on them and the findings. So thank you, Colin, and welcome.
Great. Thank you, Andrew, and thank you everyone for joining today. As you've heard, a hallmark of the Beyond Bushfires study and the 10-year Beyond Bushfires study is a focus on relationships and social networks and ideas of social support and social connectedness. So this touches on a factor I think we all recognize, is that relationships are important, relationships matter, but a key question is how they matter. So I think we all know that, it's generally accepted that having some relationships is better than not having any relationships at all. But after we go beyond that, it gets complicated. So I think the main point of my discussion here is to kind of peel back and unpack some of the complexities involved in thinking about how we think about our social relationships, how they help us, change us, hinder us, or shape who we are. And perhaps by thinking about our relationships in just a bit more complexity than maybe we typically do in these sorts of forums, we can set the stage for a bit more specific advice for recovering individuals and recovering committees. Next slide, please. So a very important, but still a very broad message that you'll no doubt have heard is that social connectedness matters again. It's a good thing for our well-being, it's a good thing for our mental health, so on and so forth. For a long time, in an academic sense, this has long been known in terms of social support, which really is most often seen as a perception or a feeling or a recognition about whether we can fall back on others around us, whether they serve as a social resource, either a social emotional resource or maybe a practical resource that helps us get things done. And on a policy-making level, that's a very important message to be aware of the importance of social connectedness when we're making decisions about recovery priorities. But when it comes to figuring out specifically what is best to do, what might be done, it's still a very broad message. So in social network analysis, the field of research we're talking about here, again, we're trying to talk about social connection in a bit more nuance. Next slide, please. But again, so it gets complicated once we move past this general idea that having a few relationships is better than having none at all. We quickly, some key questions quickly arise that kind of make problematic whether a social relationship is beneficial or not. We can think about what type of relationship we're talking about. Is it a close relationship? Is it a more of a distant co-working relationship? Is it someone we haven't seen in 20 years, or is it someone we've seen every day? Sorry, excuse me. Light issue. There's a question of how many social connections should we have? Is more always better? Or do we reach a point at which we simply have too many? And a particularly important point is under what circumstances that relationship, what's the context for that relationship? So this is again, a particularly important question in a bushfire context, because so many of the people we have relationships with, if we've been through a bushfire, will have also themselves been affected by the same bushfire and will need help themselves, as well as potentially providing help to us. Okay. We can ask, what is the relationship good for? Are we talking about mental health? Are we talking about job performance? Are we talking about feelings of connections to one community? Is it good? Is the relationship good for everyone involved? Is it mutually beneficial to both people in that relationship, or is one person getting the benefit maybe at the expense of the other? We can think about ideas of maybe negative social influence flowing across even good social relationships. So people having a negative influence on others. And finally, or not finally, but one more question is, how does a relationship between two people maybe affect a third person who isn't part of that relationship? So these are just a few of the questions we can ask to get a sense of the complexities involved. Next slide, please. So one important step in breaking down these questions comes in thinking about the many different forms of social relationships we can have. Here we see just a few examples. We can think of relationships in terms of the different types of social roles we have with respect to one another, whether that's family relationships like marriage or kinship, whether it's friendship, whether it's a co-working relationship or a caring relationship. We can also think in terms of the content of that relationship, or what's kind of exchanged between individuals. Is it social support? Is it important information about recovery? Is it advice? We can also think about the emotion or the behavior that's incorporated into that relationship, such as, do I like or dislike a person? Do I trust them? Or even, are there negative flows of influence or behavior, such as conflict? Next slide, please. So in the bushfires research, we've mainly focused on 3 general strands of relationships. One is we focused in on domestic partnerships and marriages as a specific and very important influence in our lives. Next, we've zoomed out a bit to look at webs of social support relationships across the community, to look at how emotional and practical assistance unites people in the, or potentially divides people in a community, and how our position in that community network may influence our mental health and well-being. And finally, we've looked at how our linkages with one another through what we do, whether that's our participation in community groups, such as sports or churches or environmental committees, so on and so forth, may benefit us or not. So in the next few slides, we'll get a taste of these dimensions. So first, looking at domestic partnerships and marriages, we're interested in how partners influence each other's mental health. Again, we recognize that who we're partnered with is a major influence on our lives, for better or worse. And it's good to know that this relationship comes under particular stress and importance as well in the months following a disaster. And it's often a time of big decisions in these relationships. Researchers have found heightened, not our research, but in other research, scholars have found heightened rates of marriage and childbirth in the months following a disaster, but also divorce. So people are doing things in their relationships after a disaster. So that for that reason, it's not really been settled the degree to which being in a partnership or a couple is actually a protective factor, especially for women in post-disaster settings. It's not quite been settled. So one of our questions was to look at how spouses and partners influence each other. And our main finding here was that it really matters how individuals are predisposed towards coping with the adversity in a post-disaster setting. And how they cope has a big impact on their partner. So we did this by looking at a thing called attachment style. Some of you may know what that refers to. Unfortunately, I don't have the time to go into too much detail about this, but suffice it to say here, these attachment styles are personality-like tendencies to cope in certain ways within our close relationships. So our main finding here pointed to what is called an avoidance style. This is the case where people tend to cope through being excessively self-reliant. They tend to dismiss problems until they're overwhelming. They tend to minimize problems. They're excessively independent to a fault, and they tend to perhaps withdraw in the face of stress. And what we found is that people, especially men who displayed this general tendency, were having a negative influence on both their own mental health, but also the mental health of their partner, typically their female partner. Next slide. Next, we zoom out a bit and look not just at partnerships, but at the wider community and the connections. So here we actually linked up respondents according to who they nominated as close emotional support or someone who supplied practical supports. And this gives us these social network diagrams called sociograms, which we can both look at, but we can also analyze them statistically for certain patterns that pop out. And I'll kind of give you a hint about what those patterns are about. So these patterns allow us to make comparisons and contrasts between a few people who are connected together. And this gives us a sense of what kind of social processes, what kind of social influences are happening within communities. Next slide, please. So in particular, we looked at PTSD and depression, as you've heard Richard discuss before. And as expected, we found this kind of common mantra that, relationships are important. So as expected, we found that generally speaking, fewer support relationships were a negative thing for both depression and PTSD. But interestingly, there are some slight and important differences. Those with depression tended to report fewer support relationships themselves. So they reported their depression and then they said, I feel close to this many people, and that tended to be fewer if they were depressed. PTSD was important had a similar but importantly different finding, where a person who reported PTSD tended to be nominated by other people less often. So fewer people saw them as close emotional supports if they had PTSD. Furthermore, depression tended to, we might say, cluster in the community, meaning that those with depression were likelier to feel close to those who were also depressed. So while having more connection might be a good thing, if we are also connected to someone who has a negative mental health status, that is at least a signal that our own health status might be lower. We're trying to unpack this relationship and what it means specifically. But one possibility is a kind of influence or contagion process where depression is kind of spreading among social relationships, where someone's depressed and they have an effect on those around them. Okay. PTSD was slightly different, where we see them more in zones of fragmentation within the community. So PTSD tended to appear in areas where there was less density or fewer people knew and supported one another. Again, we're still working on unpacking those relationships, but more is incoming. Next slide, please.
Colin, if I could just give you a prompt, I need to hand over to Lisa in 2 or 3 minutes, please.
Okay.
Thank you.
Sure. Thank you for that. I'll speed along then. So I want to take a bit of a closer look at one type of relationship, which is people's connections to one another through groups. So this is again a sociogram where the colored dots are people and the white squares are groups they belong to, again, whether that's church groups or sports groups, environmental committees, local community groups, you name it. Next slide, please. And I guess I'll end maybe with this slide, which just presents the findings. So we asked each participant about the groups that they were involved in and related that again to depression and PTSD. And interestingly, we found that a medium amount or a moderate number of group involvements was best. It wasn't about it was certainly a question of not having too few. If you had none, that wasn't a good thing. If you had no group involvements, that was a negative thing. But it was also a case where if you had a great number of group involvements, that could be a negative effect on your subsequent PTSD or depression. Interestingly, though, that was both an individual level effect and a community level effect. So what does that mean? That means if I reported a medium amount of group involvements, that was good for my mental health in subsequent years. So I have a moderate number, I'm not overburdened, but I'm feeling connected to my community, perhaps. However, additionally, I got an additional boost if I simply lived in a community where there were many moderately involved individuals compared to a fewer number of very highly involved people. So if there was widespread participation where most people were involved in a couple of groups, that was the best situation. And if you're interested in finding out more about that discussion, furthering that discussion, perhaps we can do that in the question time. So back to you, Andrew.
Brilliant. Thank you, Colin. And apologies for rushing you along. There's so much fascinating stuff that we would love to spend all afternoon on, but time's a little bit against us. Some incredibly useful insights, I think, there for people working in communities, whether that be in local government, state government, with some of the not-for-profit organisations involved in recovery, or indeed local people on community groups to really have a better understanding into the future of how some of these groups are working and functioning and what things are at play. We'd like to move now back to Lisa to talk about some of the more physical and environmental factors, particularly rebuilding and relocating and the impact that that's had on some of our people that we've been working with, the natural environment and children and schools. Thanks, Lisa.
Thanks, Andrew. And I totally agree that finding about connection to community groups is so important as an opportunity to invest and contribute to community resilience both before and after disaster events. But it would be wrong of us to pretend that it was all rosy and everything was lovely and everybody just needed to get along, because inevitably there is conflict and there's a lot of anger, there's exhaustion and frustration, and people don't agree on what should happen. And so that's the challenge of sort of maintaining connections and keeping things going. And one of the sad realities, as we can see on this next slide, is that there's also an increase in experiences of violence in these communities. And there was the previous ADA webinar focused on family violence, and it was a fabulous webinar. I recommend having a look if you haven't seen it already. And our research backed up what was being presented there, where we found that women in high impact communities were 7 times more likely to report experiences of violence in the 3 to 4 years after the Black Saturday bushfires. And we've got more data there where we want to learn more about this and what are some of the risk and protective factors. But we did find in this study that that for those women who had those experiences, they were more likely to also be experiencing income loss and to be showing more severe signs of mental health problems. So a really important consideration when we think about service provision in these contexts. Thank you. Next slide, please. And I guess, you know, one of the really important considerations for people living in communities, and particularly if their homes have been damaged, is where they're going to live. And will that be within the same community, or will they actually move somewhere else? And we learned that it was an incredibly agonising decision. And so we included this focus in our research and quite deliberately recruited people into the study, not just those who were still living in the community, but those who had chosen to move away. And looking at the next slide, I'll give you a sense of what came out of that research. So we found that for those who stayed, they typically felt a stronger sense of connection to their community, and that was associated with higher levels of well-being. Whereas those who moved away were more likely those who had experienced property loss and were struggling with all of the challenges happening within the community. But by moving away, they benefited by not being part of all of those extra stresses and disruptions and the rebuild and all of those challenges. But they also missed the opportunity for shared processing of the original trauma. And so that there was the lingering impacts on their mental health from the original disaster experience. Whereas for those who stayed, they moved on from that, but they were affected by that loss of their social networks. So I guess what we found was that the levels of well-being for people 3 to 4 years after the fires were about the same, regardless of whether you stayed living in community or if you moved away, but we're influenced by different factors. And so that's a really important part of decision making for those people about which of those elements are more of an issue for them, more important to them, but it also guides us on where services should be provided and what the focus might be. So if it's within community, it might be more about building advice on building regulations and financial support and relationship support. Whereas for those who move away, it might be more about processing of the original trauma experiences and connecting to new community. Thank you. Next slide. For those who did decide to rebuild, the majority of them started in the first 2 years after the fires, and then almost all had begun within the first 4 years after the fires. And we asked them about whether they felt that that timing was about right for them, because there's a lot of public pressure for everyone to be back in homes, rebuilt homes in a very short space of time. And we really wanted to find out, is that a critical factor or not? And there was a slight trend towards being more satisfied if you started earlier. But as you can see here, the vast majority felt that the timing was about right, regardless of when they started. Thank you. Next slide. One of our real concerns and interests is about what happens for younger people in disaster contexts. And there's a lot of related studies we've engaged with here, and I'll only be able to give you a few points today. But the first thing that we found was when we interviewed families, children, grandparents, parents, was that the drama of what had happened was actually just part of the normal backdrop of these young people's lives in the years afterwards. They were quite matter of fact about talking about all of the things that were happening in their community. But that's not to say it didn't have an impact. We certainly saw signs of a lost sense of safety and stability that was impacting on young people of different ages and in different ways. And so, as you can see from the next slide, there was just a lot of change they were dealing with, as well as things that caused anxiety. And so when things were tracking along at a reasonably undemanding level, they were coping, but transitions, new experiences, triggers from the old, from the disaster experience could really set things off. And when we analysed services provided in the wake of the fires, actually, this was not a factor that was addressed to any great extent. And so we would really encourage a focus on restoration of safety and stability, recognising that that doesn't mean necessarily protecting children and treating them as passive victims, but giving them the knowledge and the sense of competence so they understand what's happening, what they do in those events, and what adults will be doing for them to help them to keep safe as well. As we look at the next slide, one of the findings was about the impact on parents and their parenting. A lot of the resources that were out there were on how do you support children, and in fact there was very few of those at the time of the Black Saturday bushfires, but they have emerged since. But not a lot focusing on how it impacts on the way you parent your children and your capacity to parent. And we did find that the experience of the fires and all of the stuff that happens afterwards really wore parents down. Many spoke of losing their patience and their ability to be calm with their children, and also spoke of changes in their children so that different parenting styles were required and changes in family dynamics. So a really important space there to recognise that the family unit is shifting at this time, and a lot of adjustment and support is required. If we go to the next slide, what we saw this reflected in students' learning. So the trauma impacts for the child and what's happening in their family and in the broader community was reflected on their learning, in the sense that we saw a delay in progression, academic progression. So we followed a cohort of students across the state that began school in prep before the fires happened. So all the kids started on the same level. And then we looked at the students who came from bushfire affected communities. How were they progressing in their learning from grade 3 to grade 5 using NAPLAN results? And we found that their reading and maths were not progressing as expected on average. So this was a real concern, because this is 4 years after the fires. And we were then funded to extend that research by state government. And what we found, if you go to the next slide, was when we looked at that same cohort of students from grade 5 to year 7 to year 9, and we looked at their academic scores, that they were on average behind their peers in every subject area. So this is up to 8 years post bushfires. So we really see a long tail in the effect of the bushfire experience on learning and academic pathways. What is of real concern is that this cohort of students who began school with catastrophic bushfires were in the grade prep and grade 1 students were in year 11 and year 12 last year. So they ended their schooling with bushfires and pandemic as a characteristic of that year for us as Victorians. Okay, next slide, please. So the question is, what can we do about that, and how can we support students and school communities? There's not a huge amount of evidence out there about what to do, but there's enough to indicate that school-based programs can make a difference. And I find that incredibly encouraging. The question is, which programs? And what we know is that there's an outpouring of support that goes to schools after these events, and it's really hard for the school leaders to determine what programs they should accept, because that can be overwhelming at a really difficult time. So we were commissioned by state government to develop a tool for school principals and school leaders in their decision-making progress. And as you can see on the next slide, we designed it as a mechanism so they could do a really quick checkbox appraisal of what might be needed in their school, and then program providers have a matching appraisal to say, and this is what our program provides. And the Department of Education and Training has allowed us to make that available as, to whoever would like to access that. And so that's available there, and it's also on our Beyond Bushfires website. So we're trying to use the findings in every way we can to make a difference. And as you can see on the next slide within our report, we've talked about recommendations. And this is not to be really prescriptive. It's just that sometimes it's hard to translate the research findings into something practical. What can we do with that? And so we've made recommendations there on what you could do with our findings as a community member to increase disaster resilience and recovery, as government and service providers, and for school communities. And so if you see on the next slide, we have a link there to our website, and you can download, oh, sorry, Andrew, this is actually goes to yours, but you can download, you'll get to the slide for the Beyond Bushfires website. The report is available for everyone. It's really high level key messages, but we've referenced those throughout for people who want the technical detail of the academic research. Thank you.
Fantastic, Lisa. Thanks again for a really rich story of some of the key findings there. Interesting, some of those issues around relocation in particular, I vividly remember from the Bushfire Appeal Panel, the decisions that were being made about when and how to provide assistance to people, and the challenges that people were having in terms of relocation decisions. The ways in which this research could come to the fore in the future, I think, are really numerous and almost hard to comprehend until you start to really give it some thought. So with that in mind, I just wanted to briefly touch on that last point Lisa made, which is about how we might apply the findings of the research in practice. And on the slide there, there's just a few examples of some of the work that many of us around the call, around the research, have been involved in over that last 10-year period since Black Saturday happened, ranging from the work of the Australian Business Roundtable for Disaster Resilience through some of the specific things we've done in Red Cross, which have included utilising the research to really strengthen our approach to reunifying people through the Register Find Reunite service after disasters, the recognition of the importance of people being connected back with relatives and loved ones if and when a disaster takes place has really been highlighted out of the research. Likewise, we've been fortunate to work with the ABC and a number of other organisations, particularly some of the emergency services, to help create a play school program that was featured a couple of weeks ago, targeting obviously preschoolers. And the material that we developed supports children and parents after disasters, and through the work with the Phoenix Australia Foundation, organisation I should say, we're able to start to develop some new psychological interventions targeting children and young people in particular. And as a general theme, I think a lot of the work that's come out of this research has already begun to inform things like the National Disaster Risk Reduction Framework, training and advocacy work that a range of organisations are involved in, and indeed much of the work of ADA in terms of framing up the Recovery Matters forums and the like. So I'd like to move now to questions, and we've had a really good response from people. I think we've got around about the 30 mark in terms of the questions. And bear with me as I go through these and try and choose for us some of the most significant and salient ones. In so doing, I might actually ask with one that we had identified as potentially an issue earlier in the piece, and that's the role of nature in influencing recovery, how people who live in certain places and connect with nature may or may not recover better than others who do or don't. So, Lisa, I'd hand that one over to you if I may.
What I might do is throw to Karen Block, one of our co-investigators who I know is attending the webinar. And if she can be taken off mute, she's the perfect person to answer that question.
Hi there, can you hear me okay?
Yes.
So yeah, we did, it was interesting. I was very heavily involved in the qualitative interviews that we did with people, and when where we went out to communities and asked them to talk to us about or show us really what was important to them in their community, and also talk to us about what had changed. And we were really struck by how frequently people just wanted to talk to us about trees and about nature and about I guess the impact, how they really felt profound grief at the loss of nature when the fires happened, but also how important it was to them to be able to watch nature recovering. So even though when we started out, our real focus was on people's social relationships, it became extremely clear to us that people's relationships to nature were hugely important to them in the process of recovery. So we then went back and analysed our survey data to look very specifically at this, and luckily we had just a couple of questions where we could do that. And we found out that people who had reported feeling closely connected to nature were far more likely to have more positive outcomes in terms of their mental health. So they had less PTSD, less depression, less mental health problems overall. And they also had more resilience and were more strongly connected to their communities. So there was a really strong correlation between reporting feeling connected to nature and having better recovery outcomes, which we found was really fascinating.
Thanks, Karen and Lisa. A number of questions have popped up around PTSD, Richard, which I'll defer to you on. In particular, there's a question around whether the PTSD figures that you were showing were for the general public, or was there any difference between those and figures that we might traditionally see for volunteers and support workers of various different agencies? And the second part of that, the issue around females being more likely to have PTSD, do we have any understanding of the reasons for that?
As to the first question, we're really not able to answer that. When we first set this up, we were actually hoping to look at people that were playing a response in the Black Saturday fires, but it was really sort of in the context of the community that we had to focus. So we can't answer that. In hindsight, we've been able to do this a lot more, for example, in last season's fires, where there is currently a lot of work going on to try to understand that better, but that's a lot more recent. And those lessons are still being learned. In terms of the female, we don't have any data from Beyond Bushfires about why women are more at risk, but we know from hundreds of studies around the world, disaster and otherwise, that women are more at risk. Some people argue that it's a little bit about potentially different sorts of exposures to different types of trauma, particularly interpersonal trauma may put them more at risk. There's actually hormonal explanations, and there's good evidence for why the hormones might play a role, and how that impacts on how people deal with trauma and the stress response. So it's a very multifactorial reason, but it's very, very well documented.
Okay. Thanks, Richard. Appreciate those answers. In terms of some of the social connections, Colin, any thinking on the social connections and people's ability to rebuild and move on with their lives today?
Well, that's one reason why we are so interested at the community level effects. So not just looking at you and your own connections and how that benefits your mental health, but we are interested in how that aggregates at a community level. So how does community A, which may have a certain level and distribution of widespread community participation versus another community that may have lower, spottier participation, how do those two communities how might they compare in terms of recovery? And the social capital literature would certainly emphasize the role of civic participation as providing these kind of democratic forums for people to come together and make legitimate joint decisions about how to allocate resources in the recovery field. So it's really seen as a linchpin of local democratic forms of recovery.
Great, thanks, Colin. And another one that I'm not sure if it's for you or indeed for Richard, but there was a question around research regarding people who've moved away from their community post-disaster. While they might avoid the depressive clusters, wondering whether they're more likely to feel isolated and have other challenges as a result. Perhaps that's one for you, Richard.
I'll also let Lisa correct me on this, but my feeling is we're not in a strong position to say that, because I think we really wanted to address those questions closely. But practically tracking all the people who'd left was not easy. Relative to finding people who are actually still in the communities. But also it's a very self-selective sample. The people who leave typically are going to be many of those who are lost their entire property. They had to leave. So there were other factors as to influenced why people left and why they didn't leave, which makes it difficult to determine whether leaving itself is actually helpful or unhelpful. My gut feeling is that leaving is neither helpful nor unhelpful. It's probably the reason why one does it and how one does it, and the level of support that one has where you're going and also where you're staying.
Yeah, look, I agree, and we'll just add that the literature on this is really varied because the circumstances are so varied in different countries, and there are many places where people have no choice, and whole population groups are shifted to whole new areas, and in some cases they're scattered, and in some cases they're housed in neighbourhood groups. The element of choice is an important factor. Other areas, they've got the opportunity well, they're encouraged to sell their property because it's a high risk area. So there's many different scenarios. So I think we have to be careful what we draw from this, but I agree with Richard's summary on what are likely to be influencing factors.
Thanks, Lisa. Another one for you, I think, Lisa. Has there been any data collected on health recovery, particularly the difference between those who've moved away from the disaster affected area rather than those who stayed to rebuild?
So physical health, are we assuming they mean? Yeah, look, our study was primarily focused on mental health and wellbeing. We did include a measure of physical health, but well, a couple of measures, but actually the way it was completed, the data wasn't reliable. And so we weren't able to arrive at any useful conclusions about physical health status, and the international literature is really inconclusive, and it is a particular element where the nature of the hazard does make a big difference in terms of the likelihood of different types of injury or illness arising.
Andrew, it's also probably worth noting that in the PTSD literature, there's quite a bit of work telling us that the longer you have PTSD, it will negatively impact on a whole range of health indicators, and that impacts on your health behaviors like eating, exercise, smoking, alcohol use, but also on hardcore physical indicators like cardiovascular, immune system functioning, etc. So there's a strong relationship there.
Thanks, Richard. Not everyone has friends or family living locally or wants to be a part of community groups, either existing or ones that pop up as a result of the disaster. If people don't have those connections or choose not to be a part of those groups, is there anything else identified as helpful to their recovery? I suspect that's one perhaps for Colin and or Richard.
Sure. So what if you don't have community groups? Yes, it's one thing. It'd be nice if we could just say, hey, go join a group, you'll feel better. And maybe that is the case. But yeah, there are reasons why people don't. Yeah, time, and it takes energy, and you got to have kind of an interest in what you're doing. So I think it is still an open question, certainly in our research, specifically what it is about involvement that supports mental health. But I think there's some interesting possibilities from the literature. There's again a sense of connection, a sense of identity, which is good, and I don't think that necessarily has to come through a community group. I think other people might have views of that, but there are a few other things that community groups tend to provide that might benefit your mental health, one being routine interaction and predictable interaction. So having a sense of routine can be a support for mental health. More specifically, in terms of a connection aspect, having routine that coincides with the routine of your friends and family and community members is useful, because knowing when and where you can connect with people who are your friends and family and who are teaching you things and sharing with you information is probably an important aspect. So do we have these windows of opportunity to kind of connect with one another? And community groups are probably a really nice forum for that, and they have some nice recovery potential as well in terms of coordination. But I'm not sitting here saying that that's the only way to get those kinds of resources.
And I think the other point to note too is that something Colin and I are looking into in the data at the moment is not everybody's the same. So everything that we've been saying today, it's not the same for everybody. Everybody's a little different. And we know that in terms of people's natural tendencies to need and rely on others to help cope with life, it differs. And some people actually are better off coping with less support. They prefer it. And we shouldn't be imposing that on them. And so whilst the majority of people tend to sort of benefit more from having the social support around them, others tend to perform and cope in different ways.
And if I can jump in there, of course, that brings us back to the natural environment as well. And we certainly met and interviewed many people who tended to be more solitary, but drew an enormous amount from their connection to the bush that surrounded their property. So, and I think, during pandemic lockdowns, we can all relate to the value of walking in green spaces. And we also met many people who did beautiful creative work and were able to help process emotional reactions in that way as well.
Lisa, with that in mind, any advice for how people can increase their resilience for future disaster events? Is that something that emerged from the findings?
Well, I guess there are learnings from the recovery that we can feed into preparedness. I mean, obviously, there's disaster resilience education programs, and so just knowing how to be bushfire safe and those sorts of strategies, which are really important. But that we had some findings there about separation from loved ones during the fires that were quite stark. There were people who about half of our sample was separated from loved ones, and some of them for over 24 hours, which must have been terrifying. And we did see a link with longer term mental health impacts. So being prepared is recognizing you have to plan for separation. You have to plan for a situation where mobile phones don't work. And I can't believe I'm telling you this, Andrew, because this is Red Cross's area of expertise. And making decisions that are not just based on physical safety, but are based on mental health outcomes. You know, a lot of people think, well, you know, I'm ready to defend and I can survive that, but are perhaps not taking into account, but what damage might that do to how I feel and how I cope. So those are elements, and being connected locally is another obvious thing to think about in terms of increasing your likelihood of being able to fare well after an event. Just being connected locally and having people to access information and support.
That's great. Thanks, Lisa. And certainly some of those findings have been a real driver as we've reshaped that registration process post-disasters, which has been invaluable over the last 10 years. The other one that I would ask is the issue of post-traumatic growth is something that was, you know, a relatively, if not a new finding, something that was explored in quite a bit of detail out of this work. Could you tell us a little bit more about that?
Andrew, I'd love to throw to Lou Harms, one of our co-investigators. I know she's here and just needs her mic. Yeah, I think she's ready now. So Lou, this is your area. I'll defer to you.
Thanks, Lisa. The issue of post-traumatic growth is a really important one post-disaster. It's part of how people engage in their recovery, and it's really the idea that alongside the distressing impacts and not to any degree negate those impacts, people frequently also report positive aspects of the experience. And what we've done, and we're in the process of analysing closely, is look at the standard domains of post-traumatic growth, which are around an appreciation of life, engagement with personal strength, a sense of new possibilities, a sense of relating to other people better, and a sense of spiritual change. And our initial analysis shows that the higher impact communities do seem to be showing the higher rates of post-traumatic growth. And so part of that seems to be about growth occurs where people are really looking to make meaning out of experience and make connection out of experience. And I think it's a really important area of ongoing inquiry because it feeds into the kinds of interventions around positive mental health supports that communities can actually mobilise after a disaster. So I'll leave that there because we're in the throes of analysing that data more closely, but it's such a critical agenda item, I think, for future research.
Thanks, Lou, and a really interesting one, that. I'm going to draw the questions to a close there, but leave the audience or the participants with one key question that I'd ask you to actually take away and think about as a result of today's discussions, and particularly when you get a chance to have a look at the report online. And that is, how can you best use or apply the findings out of this incredibly valuable research? Please go away after this session and give a little bit of thought to how you might actually look into things in a bit more detail and start to explore how you might apply some of these findings in the work that you're doing, whether it be at a community level, at a policy level, or whatever else it is that you're involved in. Let's really try and maximise the value of this really important piece of research that's taken, you know, a good deal of time, a good deal of effort from so many people. Let's make the most of it. So that's about all we have time for. I'd like to again thank Lisa, Richard and Colin for speaking with us today in launching this 10 Years Beyond Bushfires report. I'd also like to thank Amanda, Greg, Melissa and Charlotte from the AIDA team who've been pulling the strings together and organising today and making it happen. That's no mean effort. There'll be several more webinars in coming months to take a more detailed look at some of the research findings piece by piece, if you like. As a participant at today's webinar, you'll receive further communications about those as they become available. In the meantime, as I said, please don't forget to go to www.beyondbushfires.org.au to download a copy of the report, share it widely through your networks, and as I said, challenge yourselves to think about how you might actually use the findings to improve things in your communities. And just finally, on behalf of ADA and the Australian Red Cross, thanks again for joining us today. I think we've had a fantastic turnout. We'll send you an email once the recording from today's session is live on the Knowledge Hub, just as a follow-up. And lastly, when you exit today's Zoom session, you'll be asked to complete a short survey, and we ask that you take a few moments to provide your feedback so that we can make sure that when we do these events into the future, whether it be ADA or a combination of ADA and other organisations, we can do those in the best way possible and provide you with the sorts of insights and information that are really going to help progress things. So thank you again to our three presenters, a really invaluable session, and in particular, thanks to everyone who's been involved in pulling together this extraordinary piece of longitudinal research. We look forward to talking again as we go into more detail about some of the individual topics. Thank you all, and hope you have a good afternoon.